Good afternoon. Welcome to the weekly Joint Task Force briefing. I want to talk initially to those folks who are unvaccinated, who have chosen not to take advantage of the ample opportunity to get vaccinated. I want to make 2 points. First, vaccines are normal, safe, effective, and life-saving. And almost all of you have had multiple vaccines in your life. There's 6 or 7 or 8 vaccines that are required before any student starts school. They're mandated, absolutely required. So you've had them. This vaccine is no different. It's safe, it's effective, and it's life-saving. My second point, I know some people have said, well, whether I take a vaccine is my personal choice and it only affects me. That is only half right. Yes, it is your personal choice. It cannot be mandated. But your choice not to take a vaccine is adversely affecting everyone else in at least 3 ways I know of from what the doctors have told me. First, an unvaccinated person catches and spreads COVID-19 to others more often than a vaccinated person does. 2, because about 50% of the U.S. population is unvaccinated, it has allowed the virus to last and to circulate longer, which allows the virus to mutate more. And a mutated virus can be less affected by a vaccine. Third, unvaccinated people are more likely to be hospitalized, including being admitted to the emergency room, which has caused and will continue to cause care to be delayed to those needing emergency care. Your decision not to get vaccinated is adversely affecting everyone else. Please get vaccinated. I want to give you a couple stats. In June, when the numbers were going down, we had 14 COVID deaths. As the variant has spread throughout the United States in July, we had 41 deaths from COVID. And in the first 10 days of August, we had 24 deaths. Those 41 deaths in July, those 24 so far in August, almost all of them are preventable or were preventable. Get the vaccine. As of August 10th, our calling agents have made 55,000 calls and talked to almost 37,000 individuals. And our team, called Our Best Shot, is canvassing low vaccination areas. They've knocked on almost 20,000 doors. And actually, those people now who say they'll take the vaccine, we will vaccinate them with the fire department will come shortly thereafter and vaccinate. We've done almost 100 of those. We still have Pipkin open. All the drugstores are still vaccinating. Please get vaccinated. Now I'll turn it over to Mayor Lee Harris.
Well, good afternoon, and pleased to be here. We have encouraged mask wearing in indoor locations. In addition to that, we all know about the requirement of masking in the schools. It's one of the most aggressive approaches of any county in our state, but just to echo what Mayor Strickland said, we don't want to lose sight of vaccination, right? That's the one way we're going to get out of this pandemic once and for all. The vaccine is more effective than masking or the other mitigation strategies we have talked about over the last 18 months. In addition, I'd ask organizations in town to ramp up their efforts at vaccination among their constituencies. Vax or test is the name of the game at this point, and that means either mandate the vaccine or consider mandating regular testing among your unvaccinated. We believe that many of your employees will support that action. We surveyed 400 Shelby County employees recently just to get their sense around the mandating of regular testing of unvaccinated individuals, and that's just what we found. So I can't see the slides here, but let's put up the first slide. So our survey indicates that the vast majority of our employees reported that they would support regular testing of unvaccinated individuals. As you can see on the next slide, about 82% of those employees support regular testing of unvaccinated healthcare workers. In addition to that, about 77% of survey respondents reported support of regular testing of all unvaccinated employees. And in addition to that, we spent a great deal of time receiving and sifting through comments from survey respondents. And almost all of the responses supported a vax or regularly testing approach. So some of the comments included comments like this one: it is important we set an example for the public and protect ourselves while serving the community. Or comments like this one: I do think regular testing of the unvaccinated would be a great thing to do. I think it would be the best solution to keeping employees and the general public safe. Or this one: this is a practical step to reduce the spread. This also signals that the time has come to move beyond voluntary measures to stop this virus. So let me end by reiterating that every organization should consider what additional steps they can take to encourage vaccination among their constituencies, including, if they can, requiring the vaccine or requiring regular testing of unvaccinated individuals. We can all do our part to slow the spread. At this time, I'd welcome to the podium the Director of the Shelby County Health Department, Dr. Michelle Taylor.
Thank you, Mayor Harris. I'm here to present the COVID-19 data update for this week. Total cases of COVID-19 in Shelby County to date is up to 112,026. New cases reported as of yesterday, August 11th, 574. The 7-day average of cases per day is at 588. Active cases currently, meaning that the individual has tested positive within the last 14 days, is 6,464. And the 7-day average test positivity rate is 20.9%. The effective reproductive number, or the RT number, is 1.36, and there are a total of 1,040 vaccine breakthrough cases identified to date. Of our 18 to 24 population, there are 13.1% active COVID-19 cases, and of our 25 to 34-year-olds in the county, there are 20.9% of those who have active COVID-19 cases, of the cases that we are talking about. That represents the largest share, that 18 to 34-year-old population of people who have COVID-19 and active cases today. If you look at the bar graph of the active case rates by age, you'll notice that as well. Going on, population vaccinated by age, the 18 to 24-year-olds and the 25 to 34-year-olds have some of the lowest vaccination rates to date in the county. When we look at hospitalizations and hospital utilization rates, we are almost back to where we were in December of 2020 and January of 2021. So if we continue on the current trajectory, we will surpass that past peak. And once again, the COVID-19 test positivity rate, 7-day rolling average, right now is at 20.9%, meaning that of all the COVID-19 tests that are done in Shelby County, 20% of those tests are positive currently. And finally, we set a vaccination goal for Shelby County of vaccinating 700,000 folks in the county. Currently, we are at 61.8% to that goal, with 432,796 people vaccinated. But the number that you should really focus on is the percent of the population that's vaccinated in Shelby County currently, and that percent fully vaccinated, meaning they've completed the entire series, is 36.8%. Of the eligible population, meaning that people are 12 years of age or older who are eligible to take the COVID-19 vaccination, it is 44%. And then when you look at the pediatric population that is eligible to be vaccinated, currently there are only 23.3% of 12 to 17-year-olds who have been fully vaccinated in Shelby County. So today, I want to explain just how urgent this is as we give this report. It couldn't be more urgent, and I want to speak as a mother, as a pediatrician, as a public health practitioner, and as a scientist. We are at a critical point, and the two messages that you need to hear today, and they have been reiterated already over and over again: please wear your masks when you know you are going to be out in public, when you know you are going to be in indoor settings, when you know you are going to be in crowded settings outdoors. And please, if you are eligible to get vaccinated, please get vaccinated. Everyone 12 and up is eligible to get vaccinated. And we are pleading with you, I am pleading with you, to get vaccinated. I'll now turn it over to Chief Sweat.
So today, I would like to speak to you just a moment about the impact that the COVID epidemic has had on our ability to deliver EMS systems in the community. But first and foremost, I can't go on any further without saying thank you to the Memphis Fire Department employees, the dispatchers, the firefighters, the paramedics who have been going through this pandemic every day, 24/7 for the last 18 months. I want you to know that our EMS system has been taxed. We have been required to do more. We have flexed our capacity. We have looked for ways to deliver service in different, more efficient ways. But at this point in the pandemic, our system is very, very stressed. Our first responders are running on fumes. They have been there every day, fighting every step of the way, and they're running on fumes. And I can't say anything but thank you. They've showed up every day for you, the citizens in this community. I want to put some data in perspective. And to explain to you why our system is taxed. The first 11 days of August, our call takers have fielded nearly 5,200 emergency 911 calls. That's an average of 469 a day in our fire department dispatch center. To provide a comparison, the same 11 days last year, our call volume was 383 per day. That means every day we're fielding an additional 990 emergency EMS calls, 23% more than last year. So what you can expect, if you call 911, and we have done a lot of work in the city to make sure that we answered the phones as quickly as possible. If you call 911, you are likely, it's going to take us longer to answer the call. That is a fact, because the call volume, we have a system that is being overworked and is not built to handle this type of call volume. Since the beginning of July, our emergency calls for service has increased each week. And this week, we're nearly more than 500 more than the week before. So what that means is, in July, we had almost over 13,000 calls, 911 calls that we responded to. One of the busiest months on record. At this rate, August will be the busiest month in the history of the Memphis Fire Department that we can find data for. With that additional utilization, there's times when you may call for an ambulance and we may not have one available. I want you to know that when you call for an ambulance and a fire engine or a fire truck shows up at your house, those are well-trained individuals. They have the equipment, they have the medicine to stabilize patients there on the scene. The only thing they can't do is transport you to the hospital. So many times a day, our system, we have no ambulances available, but we do have the ability to continue to send engines and trucks to stabilize patients. What this does mean is we may have a delayed response time to your home if you call for 911. And we've talked about it many times before. 911 is for life-threatening emergencies. Our emergency departments are also overtaxed, they're overburdened, and they simply cannot, they're maxed out. They cannot handle the amount of volume that they are seeing at this time, at this rate. Our offload time, which means the time that we arrive at the hospital until we are able to get back in service, has increased significantly during this pandemic. Our average this month is an hour and a half to get a patient unloaded in a hospital. At the same time last year, it was just a little over an hour. So I want to make sure you understand, if you ride an ambulance to the hospital, you're not going to get seen any faster in that emergency department. You don't get any privilege. You will be triaged and you will be placed in the waiting room and be seen based on your condition and the rate that they can see you. So don't call an ambulance just for a ride to the hospital. It's not going to help you. Another thing, people that go to the emergency rooms to get tested for COVID, you're not serving the citizens well, because you're taking up valuable medical personnel to do a test that can be served at other locations. So you can go to covid19.memphisTN.gov and find plenty of locations that are still testing. Our Lamar Avenue site is still open. And I'd like to also reiterate, a lot of those people in the hospital with COVID right now, a large majority of them are unvaccinated. So the best thing you can do for yourself, the best thing you can do for your citizens is either get vaccinated, wear your mask, and please maintain that social distancing if you're not vaccinated. And let's keep everyone safe. Let's try to get out of this pandemic as quickly as possible. Thank you. At this time, I'll turn it over for questions.
Brad Broders, Local 24.
Thanks. Good afternoon, everyone. This question is for Dr. Taylor and Mayor Harris. I know you heard the news yesterday about House Speaker Sexton requesting a special session. Unknown right now, obviously, if it's going to happen, but what are your concerns? What's your message about the potential of the state government stripping the power from the Shelby County Health Department, potentially individual school districts in Shelby County to have mask mandates or other things, the slippery slope that this may strip county and urban health department? And I have a follow-up.
So I think you're asking for a reaction to what has been requested by the Tennessee legislator?
Correct.
So the reaction of the Shelby County Health Department would be this. Currently, the law says that we are to protect the health of the community based on local trends and what we're seeing. And what you heard from Chief Sweat and what you heard from me in the update today is that local trends are telling us that we have a serious problem. We have rising infection rates again, exponentially within the last 2 to 3 weeks. And what we also have is the Delta variant, which is much different than what we saw at the beginning of the pandemic. We're seeing sicker children. We're seeing children in ICU in a way that we weren't seeing at the beginning of the pandemic. And we are seeing some children die from COVID-19 in a way that we did not see at the beginning of the pandemic. So at this point, the Shelby County Health Department is well within the law to protect children at K through 12 schools, pre-Ks, and daycares. And one way we can protect them is by asking that everyone wear a mask, particularly in classroom settings, so that they can have a chance of being protected and a chance of slowing the spread of this deadly virus.
Thanks, Dr. Taylor. So there could be a legal fight ahead potentially. What's at stake here? And you hear some Republicans saying they're against this one-size-fits-all for all districts in the county. What's your response to that?
So my response to that is, I understand the questions. As Americans, we have the right to question laws that are on the books. I have been an Air National Guard service member for 11 years, and I have fought for those rights. But what I will say is that those laws are on the books right now, and my job as the director of the Shelby County Health Department is to carry out those statutes and do what's necessary to protect the health of the residents of Shelby County.
Kelly Roberts, WMC.
Good afternoon, and I apologize if this number has been mentioned and I missed it in the shuffle, but do we have the latest number of COVID-19 patients hospitalized currently in Shelby County? And Chief Sweat, could you give some context to how these rising cases are contributing to the stress on the EMS services?
Definitely. I'm not looking at the current hospital numbers, but I can tell you that they're going up every day. Our capacity in the hospital system is less than it was 2 weeks ago, and I believe we are quickly being one of those areas that does not have the capacity in our system. One of the things I'm looking at, just a little information here, our COVID-related calls are increasing, especially since through the months of July and August. So that is definitely related to our increasing call volume. And as you know, the more calls we make, our system was built to handle historically how we respond. It was not built to handle a pandemic of this nature. It's not a sustainable method. So the call volume has increased exponentially, especially the last 2 weeks. And we're going to continue to do everything we can to respond as timely as possible. Just want the public to be aware, if you're not having a serious health issue that needs to be seen at the emergency department, please try to seek other medical care, maybe an urgent care or your primary care physician to see non-life-threatening emergencies so that people who really have life-threatening situations going on have access to the emergency department.
Thank you. And Dr. Taylor, I know that there have been some reports that if kids were not wearing or refused to wear masks in schools, that their names may be given to the Shelby County Health Department. I know that districts were, asked to send those kids home. that the Shelby County Health Department would have staff to help enforce it. Have you gotten an idea? Have students' names been reported to the health department? Have you gotten an idea that students are complying in schools with this mask mandate? Thank you.
I can tell you definitively that no student names have been reported to the Shelby County Health Department, nor did we ask for that information. Our mask mandate asks that we work with and collaborate with our school districts, with our school leaders, with our superintendents to make sure that we are helping them enforce their own policies and procedures. Now, with that said, our statutory responsibility is that if we believe that there is a potential for an outbreak in a school, and we get reports that there are multiple COVID positive students based on just the usual illness type mandatory reporting that comes from schools, then we have the responsibility to decide if the school in and of itself is a threat to the public health and whether it would need to be closed or whether we would just need to quarantine pods of students. From what I understand, at the beginning of the pandemic, before my start with the Shelby County Health Department, sometimes that would be the case, that you would have some schools that if there was a classroom pod, depending on how they were doing testing, that had a positive, then that classroom may be quarantined and the COVID positive patient would be isolated, but possibly the school would not have to be closed. We are not in the business of criminalizing students or parents. We are in the business of preventing outbreaks in the community and making sure that any potential threats to public health would be handled in concert with the schools.
Dominique Dillon, Fox 13.
Good afternoon. I'd just like to know, in the last couple of weeks, have you seen an increase in the number of people between 18 and 34 coming out to get vaccinated? And also, are you considering offering incentives like the car giveaway once again to drum up more people coming out?
It's a great question. I don't have the specific number for 18 to 34-year-olds who may be getting vaccinated, but what I will tell you is that we have seen a modest uptick in the number of folks getting vaccinated, and we are considering all types of efforts to help increase that vaccination number. And I will turn it over to either Mayor Strickland or Chief Sweat to answer that more fully.
In answer to the incentive question, yes, everything is being considered. As you know, we've done incentives. We had a sweepstakes for an automobile. On the city side, we've been incentivizing our employees with $200 or $250 if they would go get vaccinated. I've seen other cities incentivize it, and there's really no proof that it actually moves the numbers significantly. But we are still looking at it from the government perspective.
Thank you.
Thank you.
Laura Testino, Commercial Appeal.
Hey everyone, I'll have 2 questions today. My first is this, we've talked a lot and heard a lot today about the unfortunate capacity strains that we've got on hospitals and emergency care staff. In prior surges of COVID-19, we were getting hospital capacity information daily, if not every other day. That has dropped to weekly. When can we expect to start getting regular hospital capacity information again? And I'll have a follow-up.
I'll let somebody else answer that specific question. I will say one thing that I think I'm not sure it's been reported. We have people waiting in emergency rooms for over a day to get fully treated. Think about that. People waiting over 24 hours to get treated because of this surge that's happening at the hospitals. But does anybody know the answer to this second part on the data daily data from the hospitals. Dr. Taylor.
We have been having regular meetings with hospital representatives, as well as all of the municipal mayors had a great call this morning, and the same question was brought up. I have instructed our team at the Shelby County Health Department to start ramping up and making sure that we get those numbers out more frequently. As you know, cases went down as of June, and so we were really hoping that we could spread out the time period that we would be giving those numbers, but we are ready to ramp back up and start giving those numbers more regularly. By next week, I'll be able to give you a firm schedule.
Awesome, thank you. And my question is about schools. I know we've talked just a little bit here about what protocol looks like at the department for identifying outbreaks, et cetera. But I'm curious about what a parent or family or even the community's right to know is about the status of cases or outbreaks in different schools. Here, I'm curious if there's anything at the state that precludes the health department from reporting more robustly on these cases or clusters that are related to different schools, students that are quarantined. We see pretty comprehensive data from the Mississippi State Health Department that we've never quite seen from any local or state health department in Tennessee. And as we've all discussed, pediatric cases, because most of those students can't be vaccinated, are of particular interest this year. And I just am curious why we can't get more data about those.
I understand your concern, and I understand the concerns of many of the parents. But what you have to remember is that we are bound by HIPAA laws and by different laws that govern how we collect data and how we report it. So even though you may see different types of data coming out of Mississippi, it may also have to do with the numbers that they're seeing. If we don't have enough numbers in certain schools to be able to report at a school level, then there's too great of a chance that an individual child or an individual family would be singled out if we reported at that level. That's why you're seeing a farther out, broader level of reporting when it comes to schools. I believe the reporting is at the district level, and right now we're going to keep it that way because we want to protect our the privacy of our families as well.
We are out of time. Are there any closing messages today?
I would like to give a closing message again and repeat what everyone else who has stood at this podium has said today. Please, if you are eligible to get vaccinated, and please, if you are going to be anywhere in public, wear your mask. We are in this together, and we're going to get out of this together. But we have to rely on each person to do their part to protect the health of everyone in Shelby County.
Thanks, everyone. We'll see you back here next week.